Hello, we're having a happy day with Nurse Terry K. We have discussed a lot about diabetes type 2. We talked about the overview, the causes, the symptoms, medication, what to do in order to decrease your chances of developing type 2 diabetes if possible. Now we're going to go into the treatments. So, when you're living with type 2 diabetes, you learn a lot about the condition and the lifestyle changes. And here's the education. First of all, you want to incorporate healthy eating. You want to regularly exercise. You want to lose weight if necessary. You want to take diabetes medication or insulin therapy if needed. And you want to keep a acting track of your blood sugar. And these will help you to monitor and be able to keep your blood sugar within a healthier range. Healthy eating. There's no diabetes diet. But here's some great things that you can focus on. Even though they say no concentrated sweets, no sugars, no this and that. Here's what you can do to keep yourself healthy when you're in type 2 diabetes mode. Have a regular schedule for meals and healthy snacks. Eat smaller amounts of food, smaller portions. Eat more high fiber foods. And that includes fruits, non-starchy vegetables, and whole grains. Eat fewer refined grains, starchy vegetables, and sweets. Modest servings of low-fat dairy, low-fat meats and fish. Healthy cooking oils such as olive oil and canola oil, and fewer calories. You may have to see a registered dietitian who can help you plan your diets, have healthier food choices, help you make new habits, and learn what stops you from changing the old habits. And you can watch your carbohydrate intake to keep your blood sugar levels more stable. Exercise, physical activity. It is so important that you have physical activity in your life. That's your best friend. Now, I don't get out there and walk every single day, but I am a nurse. I do some walking. I put in steps. You know, it may not be, I'm more adamant some days than others, but it's so important. Physical exercise is important to lose weight or stay at a healthy weight. It helps to maintain blood sugar. And you can talk with your doctor or someone that can help you get started in the exercise program. You may want to do aerobic activity. You can walk, swim, bicycling, or running. You can aim to get it in for 30 minutes or more of moderate aerobic exercise from at least 1 or 2, maybe 3 days out the week. At least 150 minutes a week. Strength training. You might want to do strength training exercises to help you balance your strength and your ability to do your activities of daily living. Strength training can be done with free weights, like I said before, resistant tubes, weight machines, and your body weight for resistance. Aim to do strength training exercises for all major groups at least 2 times a week. Move more. Get up. Do something. Clean your house. Get out there. You might not think about it, but getting out there in the yard, just cutting grass, or just raking leaves, or just taking care of flowers if you got a green thumb. Getting out there and doing things in your yard, that's considered exercise. Um, Breaking up the long periods of inactivity sitting at the computer, it can help bring bring your blood sugar levels to a normal range. Take a few minutes to stand, walk around, do light duty exercises or light activity exercises at least every 30 minutes. Weight loss. Losing weight can help you manage blood sugar levels, cholesterol, triglycerides, and blood pressure. If you're overweight like me, you may use these factors to improve after you lose a little as little as 5% of your body weight. The more weight you lose, the better it is for your health. Think about it. So, your healthcare professional or your dietitian can help you set good weight loss goals and make healthy life changes that can help you to reach them. But it starts with you. You have to want it. You got to want to do it. It's the mindset. You got to get your mindset trained for a better mind, for a better body, for a better you. You got to get into it. You got to stay motivated. You got to get it in where it fits in. You got to, because the goal is a healthier life, longevity, if possible. Tracking your blood sugar. Your healthcare team will tell you how to check your blood sugar levels. Tell you the exact target range. Excuse me. You can use a glucometer. They'll tell you about glucometers. Excuse me. You can keep track of how your blood sugars are running. Keep a log of how often your blood sugars run high or low. Continuous blood glucose monitoring is an electronic system that records your blood sugar levels every few minutes from a sensor under the skin. The sensor most often is the arm. The system can send results to a mobile device such as a phone, and the system can alert you when levels are too high or too low. Now you got the little thing that you can put on your arm, and you can have the little device or the phone to check your blood sugar instead of pricking your finger every day. It's always new technology use in store for monitoring our blood sugars. If you can't stay at your target blood sugar level with diet and exercise, your healthcare team might have to give you medicine to help you lower your glucose levels. You might start with insulin. Medicines with type 2 diabetes include the following: metformin. I repeat it again. I am taking metformin because I am pre-diabetic. My provider has put me on metformin, and it works mainly two ways. It lowers the amount of glucose the liver makes, and it helps the body use insulin better. And most people who use metformin may get B2 deficiency and may need to take supplements. So I do take B12, not B12, not B2, but B12 supplements. I take B12 supplements and complex B2. And the side effects from metformin may be nausea, belly pain, bloating, and diarrhea. You got other ones that are out there like Amaryl and Glucotrol XL, which side effects lower the blood sugar and maintain weight. You got glyburide, and it has a high risk of low blood pressure. You have gluconides, and it helps the pancreas make more insulin. There are many different types of medicine that can help you monitor your blood pressure. Your blood sugar. It's just up to your provider. And follow me along to part 5, diabetes type 2.